Hi, I'm Scott McKenzie, a heart failure specialist and cardiologist and general physician. I work at the Prince Charles Hospital in the Advanced Heart Failure and Cardiac Transplant Unit and the Queensland Cardiovascular Group at Holy Spirit Northside Hospital and St Andrews Hospital. Heart failure is in the end the net result of cumulative damage to the heart muscle. And there are a variety of causes out there, a huge array of causes that eventually cause that. In our community and probably across most of the world, most are caused by ischemic heart disease, either at a macrovascular level in the form of heart attacks or at a microvascular level as manifested by diabetes and cumulative effects of high cholesterol or hypertension. The other big group overall is probably familial, which would constitute about a third of the non-ischemic case, post-viral, and in Australia at least not an insignificant portion due to substances, particularly alcohol, and in modern era perhaps amphetamines such as ice. Other rarer causes include post-chemotherapy, radiotherapy, and postpartum or peripartum. So I think heart failure is under-recognised in its prevalence in Australia. About 2.1% of adults over the age of 18 in Australia will have heart failure overall. About 1 in 10 adults over the age of 75 will have heart failure. If you make it to the age of 40, your risk of developing heart failure is about 1 in 5. If you make it to the age of 50, it's about 1 in 3. There's very little difference between genders in that rate. Overall, heart failure in most of the Western world is the single biggest diagnosis causing hospitalisation. In Australia, about 1.6% of all hospitalisations are due to heart failure. The first thing to talk about with heart failure is the high mortality rates, actually. I think oncology and cancer is sort of a scary diagnosis to people, and cardiovascular disease fades over time, and people neglect the severity and seriousness of heart failure. About 50% of patients with a diagnosis of symptomatic heart failure will be dead within 5 years. Comparing that to a cancer space, the only cancers that would achieve that kind of mortality are lung cancer in men and lung and ovarian cancer in women. Everything else is far safer than heart failure. In terms of overall quality of life issues, it has a severe impact on patients' quality of life, the ability to care for themselves and their ability to participate in their family and community lives. It reduces their exercise tolerance. They become increasingly housebound, increasingly socially isolated and physically isolated, unable to do their day-to-day cares from their levels of breathlessness. It causes, or as a consequence of it, has frequent rates of hospitalisation. And once you've been hospitalised for heart failure once, your risk of being re-hospitalised within 90 days is about 30%, and out to a whole year is about 50%. And of course, with subsequent hospitalisations, that risk is reiterated, with obviously a huge impact on patients' ability to enjoy their life at home. The patients with heart failure hospitalised for symptoms, usually breathlessness being the predominant one. Patients can manifest the breathlessness either of a sudden onset, as in the classic acute pulmonary edema, waking up from sleep severely breathless, or the gradually progressive breathlessness over the course of many days to the point where they simply can't function. Other less common cause of hospitalisation, and where perhaps heart failure is missed, has been the underlying etiology, are things such as syncope and sometimes severe fatigue, sometimes abdominal bloating and ascites, and leg or lower limb edema, which can often present with infections in the lower limbs as cellulitis, rather than as overtly heart failure as such. So I think the most important thing to recognise about heart failure is just how common it is. Don't dismiss symptoms that might be heart failure, particularly in an older person, particularly when they've got risk factors for heart failure. Following on from that is that heart failure has severe impact on patients' quality of life, so making that diagnosis makes a huge difference to patients' quality of life. The final thing to think about is that the morbidity and mortality of heart failure is huge. It trumps most cancers, even though cancers are far more glamorous diagnosis. Heart failure is more likely to kill them. Patients and the carers should be aware of that.